everyone, I decided to do my literature review on motivational interviewing as a tool for behavior change in primary care. Motivational interviewing is a clinical communication skill that nurses can develop to elicit a patient's personal motivations to change their behavior and also to promote health. Motivational interviewing is a collaborative partnership between a patient and the provider. And with motivational interviewing, providers can explore a patient's understandings, their motivations, their confidences, their roadblocks to change by asking them open-ended questions. It also acknowledges their autonomy and personal responsibility, and it reserves judgment. Many chronic illnesses are managed through the primary care setting. According to medicaleconomics.com, approximately 75% of office visits are to address multiple chronic illnesses. Some of the most common chronic illnesses treated in primary care include heart disease, diabetes, and arthritis. The Department of Health and Human Services reports that chronic illness accounts for 7 out of 10 deaths and is a leading cause of death in the U.S. Traditional patient teaching on disease management and lifestyle modification is currently just simply telling a patient what to do through education. This method is often unsuccessful in motivating a patient to change their behavior because it can make them feel challenged and not in control. And in turn, a patient may try to reinsert their control by continuing the unhealthy behavior. So this creates a poor rapport between the patient and the provider. And this authoritarian approach to teaching, it doesn't take into account a patient's perspective or their needs for autonomy. So according to Dropa and Lee, patient-centered interventions like motivational interviewing, they generate better outcomes than the traditional methods. And motivational interviewing utilizes empathy and active listening to help a patient identify their unhealthy behaviors, and it guides them through the readiness to change. So my PICO question is, in adults managing chronic illness, is motivational interviewing more effective than traditional patient teaching in inducing positive behavior change? My literature review included scholarly articles addressing the effects of MI on medication and treatment adherence, diet modification, weight management, and smoking cessation. Some core concepts of motivational interviewing are resolving ambivalence, eliciting behavior change, and adherence to treatment. Resolving feelings of ambivalence can help a patient move towards change. It entails highlighting the discrepancy between a patient's current behaviors and their goals. In a pilot study conducted by Riemann, Cartman, Douglas, and Benzo, studying the effects of MI on improving the quality of life in patients with COPD, they found a significant improvement in dyspnea scores, an improvement in quality of life measures, fatigue after motivational interviewing, and a recurring theme that was reported by the patients on the benefits of MI were an increase in the sense of awareness of health and health behaviors through the MI coaching session. The component of eliciting behavior change, this can be accomplished through optimism and support of self-efficacy. A meta-analysis by Song, Zhu, and Sun researching the effects of MI on self-management and HbA1c levels in patients with type 2 diabetes. MI was used to enhance the participants' intrinsic motivation to change their behavior. And in 6 of the 10 studies, short-term MI of 6 months or less was effective in reducing HbA1c levels than in the control group. However, long-term MI was not effective. In addition to eliciting healthy behaviors, MI can also increase adherence to treatment for patients with chronic illnesses. In an exploratory study, there was an increase in footwear adherence in patients at home with diabetes after 1 week of MI. However, adherence returned to baseline over time. According to Dropa and Lee, MI is convenient, it's client-centered, and it's a highly adaptable counseling style that can help patients explore and resolve their feelings of ambivalence on their own terms. In my review of the current literature, MI was shown to produce mixed results in managing chronic illness. It was associated with short-term improvements in medication adherence, depression outcomes, smoking cessation, and weight loss compared to traditional teaching methods. A reoccurring limitation that I found among the studies are the long-term effectiveness of MI on adherence to treatment. So it would be beneficial to focus future research on enhancing MI interventions and techniques to provide support needed over an extended period of time, and also to focus on the effectiveness of MI on the long-term adherence to treatment. This can be accomplished through conducting more random controlled trials with larger samples, extending the intervention periods, and also performing longitudinal studies that show the effects of MI at different phases of intervention. So advanced practice nurses using MI as a tool for behavior change in primary care, they should take into consideration the benefits of MI, at least for the short term. MI can be used in a variety of different formats, including individual, group, or even telephone-based. Telephone-based MI is a useful tool for those living in rural areas or for the frail where travel is a physical burden. Approaches to improve long-term adherence to treatment should be used in addition or in conjunction with MI for best patient outcomes. Some strategies can include improved social support, education, and skills training.